I've been an Oryx user for probably 6 months now, and I've loved every minute of it. The features that I like the most is that it's cloud-based and that I can access it from anywhere. The other thing that I really like is that you can customize a lot of things within the treatment planning, as well as setting up appointments, so that when you go in and you click on a button, it'll pre-plan all the appointments if you've preset those settings. So I did notice an increase in patient satisfaction just because everything can be done online in the sense of, if I have intake forms that need to be filled out, that can be done at home. And it's just really convenient for patients who lead very busy lives, those who have kids, those who just work a lot. So it's just convenient for them so that they don't have to come early to their appointment to fill out those forms. I think the experience of the risk assessment for patients is that they really enjoy that, because a lot of my patients who come in, a lot of times they'll say that they feel like they are not really that involved with their dental treatment. So to be able to be given a risk assessment, they're able to learn more about what's going on with their mouth, and they can share that with their family members or their friends or whoever is important enough to help them make those kinds of decisions. I think it does, just because I think a lot of patients are just really impressed with the technology, as well as the fact that it provides so much information for them. I think a lot of times patients may be told they need one thing or the other, but by providing the risk assessment and kind of involving them in the process, that makes them feel very included, and I think that's what patients really like. My previous software, it was really hard to navigate. Oryx is actually pretty easy to navigate. It's the flow of it when you're doing the exam, it just makes sense, as well as being able to, scroll down the tabs. It's just very easy. You're not wondering like, oh, is there, do I have to press this button to get here? Like my last software, there was like maybe 10 different ways to get to the same page, whereas this is just very straightforward, which I really appreciate. The main thing was that Oryx is cloud-based, but my previous software was not cloud-based. So, you had to be at the office in order to access any patient charts, to access your chart notes. So frequently I would either have to make notes myself, so that the next day I could return and write my notes, or I would have to stay at the office to finish all my notes. Work support is fantastic. My experience with them has been really remarkable. They're very responsive in a timely manner, and they're all super, super knowledgeable and friendly. If someone's thinking of switching to Oryx, I highly recommend. I think it's fantastic, and it really has made me more efficient in terms of preparing for appointments, as well as just feeling that I really know the patient before going into the appointment, just because they're able to fill out all those intake forms prior to me meeting them.